Thank you very much for having me be part of this. I'm continuing on a health theme, but the whole morning's presentations have been, quite inspirational. So I'm thrilled to be a part of this. And I'd like to acknowledge the traditional owners of the land on which I am. I think I'm the only person from WA speaking today. So I'm on Wujak Noongar land, and I'd like to acknowledge the owners past, present and future and emerging. So this talk has been an opportunity to reflect, because I kind of never ever imagined that I'd consider myself a data scientist. So, and I've had this habit of collecting copies of name badges as I've gone through my career, and I was looking through it and thinking, I guess I have been pretty nerdy right from the start. But it's an interesting story for me, probably not for as many other people, but I grew up in Queensland, and I did a degree. I did my medical degree in UQ, and then I went on to study to be a physician and became an infectious diseases physician. And then after that, did clinical microbiology, and in amongst it, I also sort of studied some tropical medicine in Liverpool, and did Masters of Population Health, Public Health, and some health service management work. So clearly there's a geek inside me there, but I'll try and tell the story of how I ended up getting to data science. So working as both an infectious diseases physician and a microbiologist is quite an interesting combination in many ways, because you get to see hospital acquired infections, and you realize that it's 1 in 10 people coming to hospital acquire a complication, and a big proportion of those are infections. And working in the microbiology laboratory is touching on on diagnosis, of how well we diagnose infections generally. And so as my career progressed, I was doing more and more consultations of seeing things where patients had bad outcomes and had complications after their surgery. And it really got me thinking about what could be done at a systematic level, because you look after 1 by 1 patients when you're doing clinical medicine. And what I'm fascinated about was 2 things. One, the laboratory not being used optimally with bad quality samples and people misunderstanding a complex topic. But the other was what could be done more generally to try and improve patient outcomes. And I got involved with, I do teaching as well as consulting and working in the laboratory. And I did a number of students doing audits, looking at things that had gone wrong or compliance with guidelines. And it sort of, things dawned on me more and more. And then I was very lucky in 2014 to do a Churchill Fellowship to look at the issues around how antibiotics were being used. But I really boil that down to an issue of diagnosis. And so my topic, I included education and how laboratories were used, and informatics. And it turns out the informatics component of it is probably where it's got me to now. And amongst it all, when I came back, I sort of realized that you couldn't make much of a difference without the data to support it. Medicine's a very opinionated specialty, and compliance with guidelines is not always terrific. And so what I realized was data might be the way forward. And then I started realizing pathology data is particularly rich. They say about 70% of diagnoses in medicine are made with laboratory testing. So the laboratory testing, it doesn't have the issue of electronic health records or text mining. It's all recorded very accurately, but it's recorded at the level of a test, not at the level of a patient or at the level of the system. And that sort of got me interested in how could that be leveraged. And so I had done lots of little kind of projects, and then I went along, for some reason, I went to a health hack, and I came across these people who had incredible skills that I didn't even know existed. And I went on and did a series of different hackathons, working with people from completely different areas who could code, who could visualize data, who were really good at collaborating, doing things quickly, agilely. And I think that's probably what set the seed for me. So this sort of is to show you my journey through my tools, from being being really proud of myself when I could do pivot tables in Excel. And then from the hackathon, I realized what a great tool Tableau was. And so I learned to do all sorts of things to avoid coding, to try and get my data in the shape I needed to. So I made pretty pictures with Tableau. But what I realized was that the trouble with that is if I wanted to update my data, I'd have to do it all over again. And so then it started to dawn on me the role of coding and it being an essential tool, and also the role of reproducible research and how that could be done. So in 2018, I put together and was successful in getting a research grant for a statewide project, which is up and running at the moment, called WASABI, the Western Australian Smart Application of Blood Cultures Initiative. And what we're doing is we're using blood culture tests to look at the accuracy and the efficiency of sepsis diagnosis, and providing feedback to clinicians to allow them to use that information to drive change. So it's a fantastic opportunity. It was 2 years of getting through research and data governance to get approvals for it. And it's really hard to do benchmarking when the sites have to be confidentially de-identified. So there's those sorts of challenges that go along as well. And so there's a team of fantastic people that I work with now that are part of this collaboration. So it's statewide, we have 1 million blood cultures with 400,000 patients from 700,000 admissions and 48,000 bloodstream infections. And speaking to the issue of coding, the feature of it is that it's got monthly updating, and we add on another 700,000 tests per 7,000 tests per month. And it's funded through the WA Health Research Translation Grant. And this takes me to in 2020, while I was waiting for all the research governance and approvals to go through, I realized that there was something really interesting underlying this, and I enrolled in a PhD. And what underpins the PhD is the concept of the learning health system. If other people are aware of it, it's probably happens in other industries, or we know, I mean, it's derived from from industry who adapted it, but looking at action and measuring what actions are being taken in data, and then turning that into information and knowledge, and then using that to inform change. And so it's a concept that's emerged over the last 10 years, but it's been difficult to see it realized. And I started to appreciate that we had a great opportunity to do that, to build on the WASABI work, to look at how we would engineer a learning health system that could be used to support sepsis initiatives. And the design of it is such that we now have a workflow so that new data comes in every month and you can just update it. And the whole data set can, if you change a definition, you can run right back to 2006 and run it through 1 million tests to update it all. And the design of this is the concept of benchmarking, that if we could set up this system to run in Western Australia, could it be run in other health systems, and could we start trying to realise what the WHO sort of wants is that all research is done to drive translation, and that we use standardised definitions so that we can compare ourselves externally to others. And so part of the collaboration is I've been lucky to set up a international partnership with Geisinger Health, which takes me into, I've been very lucky in this process to have a fantastic data scientist, but this year I've taken on my own. And so this is my generalized additive models that I'm building into the system to be able to pick up the changes over time. So I have some acknowledgements in here. I have to, these are my PhD supervisors. And in particular, Catherine's not a supervisor, but she was the data scientist on the project. And her coding is phenomenal. And her explanations of her coding in the Markdown documents are such that I've been able to scaffold my knowledge on what Catherine's been doing and build on that. And so it's funny being in this presentation today because I'm not completely convinced that I'm a fully fledged data scientist, but you never know, I might get there. And I was thinking about enablers of women in data science, and I thought, role model. Well, one is how important it is that we have women in data science. You know, we have this, it's getting more publicity now that unless you've got women at the table, you're not looking at it from the perspective of women. And we know that that's been a significant issue in healthcare, with dosing, for example, being designed around men without considering differences with women. And in general, if we really want to have equality, we've got to have women at the table, and we've got to have women at the table with data science skills. So I think role models, mentors, supporters, and events like today are absolutely critical. I'd love to do a hackathon with the great brains that have been here today. Diversity in all its forms, because that inspires us to think differently and to look at it from different points of view. I have to say I'm an R convert. You know, my trainer wheels are such that I won't verge on to another programming language until I'm comfortable in R. But what I think is fantastic is open source software. And it removes the financial barriers, and being exposed to the incredible packages that people keep producing is really amazing at just how much sharing goes on of this expertise. I think the Tidyverse has made a big difference with making coding easier to interpret. Alok, my PhD supervisor, grew up with back in the days, even before R, and when he codes, I can't understand it because he doesn't speak Tidyverse. But I think Tidyverse has made a big difference, and I think Tidyverse has got some incredible proponents in there. The women that have worked in the Tidyverse and are part of promoting the Tidyverse work are inspiration. Jenny Bryant and the Here package, amongst others. And then we've had speakers today who are part of our ladies courses, which I think are great, software carpentry courses, massive online courses. I think there's lots of ways that data science is more accessible, that are freely available if you've got your inspiration that you can do it and other people can help you do it, and you'll get there in the end. And so the last thing I just wanted to finish up was the Churchill Fellowship was a big point for me to look elsewhere and look at what we thought we were doing in Australia was what everybody else was doing, and it's not the case. And to be able to tap into so many different brains internationally and have an international network is amazing. So I just thought the last thing I'd do here is do a plug, because I think there's probably about 26 applicants on the presenter list today who would be great candidates and who should think about becoming a fellow. So thank you for having me, and thanks for being part of this and pretending I'm a fully fledged data scientist.